Well, we're here today with Dr. Khaimov, a dentist in Queens, Elmhurst, I think that is Dr. Khaimov, right?
Yes, it is.
Dr. Khaimov, tell me, as patients, when we go to a dentist, to any doctor for that much, on one hand, we feel like a dentist is a dentist is a dentist, simply because you guys have a diploma, the government license you, and, it's pretty safe that all of you more or less learned the same in those very few universities around which teach that. At the same token, we dentists also realize that there has to be a personal match, that not every dentist is the same, especially from personality and from, what they do. Only because a person learns in theory just about everything doesn't mean he then practices it all that way. So tell us a little bit, what is your practice all about? If I have children, can I bring them to you? If I have a mom or am let's just say me being as old as I am, if I have a grandma, like an elder person, if I am an elder person, can I come to you with dentures? Would you go and do the braces on my kids? If I want a nice Hollywood smile, would I be at the right place? At the same token, if I just want to fix a couple fillings, and even though I'm supposed to do more, but I'm money conscious because I simply don't have enough because the economy has hit me, but can I get fixed what needs to be fixed to be functional? Tell me a little bit about that in your practice. What can a patients expect? And if you don't mind, while you're at it, what made you become a dentist, Dr. Khaimov?
All right. Well, first of all, my practice it's a family practice. So I see kids starting from 2 years old, and I see grandmas and grandpas up to whatever age. As long as you come to my office, I can take care of you. Every single patient I treat as my family. Meaning that I would never, doesn't matter in what income situation you are, what kind of insurance you have, I treat everyone as my family member, the way I'm going to treat my mom, my father, my grandmother, my kids. Meaning that if you need my attention, no matter how busy, how it is in my power to help you, I do help you. Now, the reason I became a dentist was that I came to this country when I was 16 years old, and I've had to receive the letter from school that I have to bring a letter from a dentist that I had a good checkup. So I went to a dentist, and unfortunately, I did not get a proper treatment. And when I did not get a proper treatment in school, I told myself, you know what, that was the time when I had to choose my profession. I said, I want to know, what did this doctor do to me? How can I fix it? And how can I prevent this from happening to other people? So that was the main reason I want to become a dentist.
Wow.
So I went to...
That's an interesting story. So basically you were slightly or a lot mistreated. It wasn't done the right way. And
Right.
and you kind of realized that affects a person very, very much. And
it affected me badly in a way that I felt, how can a doctor mistreated seriously a teenager in a way that it was unacceptable. So I said I would never ever want this to happen to other people, whatever is possible in my power. So that was the main reason I decided to become a dentist, and I keep educating myself. I keep taking different courses to get a better education since I graduate from school, so I can keep up with the economy. I can keep up with all the new stuff, all the new things that come out in the market.
Because dentistry is, I have noticed, and thanks God it is really advancing also. It isn't
a lot.
It's not just computers which advance, it's the dentistry which advances maybe because of computers and all that other stuff, like flying to the moon, and you come up with great materials. But there is a huge difference between doing a root canal today or 25 years ago, and there's a huge difference on how to straighten out teeth with braces and or how to replace a tooth. I mean, George Washington had a wooden tooth, apparently. I don't know. In fact, maybe you in dental school learned more about that, but I have heard he had a wooden tooth. That must have been awfully inconvenient.
It's awful. And yeah, we learned about the first wooden dentures, but it was only, for show, but not practical. So nowadays we learn how to replace missing teeth, replace in different ways. Dentures, implants, bridges, crowns. There are different ways.
So staying updated is obviously important, but probably, lots of doctors do that. But in any case, it's not that necessarily one dentist is a lot worse than another one, but a person should be he should be matching their personality a little bit the way a young couple dating does, and then decides that, we might not be agreeing on everything, but I think our overall personality matches us together, and we can get married, and then hopefully, as many people do, stay married their whole life wonderfully. And that little bit of dentist is a little bit like that. You got to feel comfortable. Go there with your children, bring your grandma, or whichever way it goes, and know that if I want a gorgeous Julia Robertson smile, I can get it. At the same time, if I just want to fix my little brown chipped tooth here, or get rid of my toothache, I can do that too. And you're not putting the patient down because you say, look, you need this, but he says, I don't have money now. What you're saying is you will work with him, you will work what needs to be fixed so he doesn't get any more sick, and then hopefully make a plan that one of these days he might be able to fix it all.
Absolutely. I work with different we create treatment plans that works for you. I work with you. If needed, we make different kinds of payment plans. So it's very convenient for you. It doesn't kill you. It's very affordable. And my prices are not sky high. It's very affordable, down to earth, nothing unpayable. Basically.
Beautiful. Dr. Khaimov, very good news. Thank you very much.